Today we are covering high-risk pregnancies, focusing on the concepts most likely to appear on your NCLEX exam. The exam tests your ability to differentiate between hypertensive disorders, so let's start there. Gestational hypertension is new-onset high blood pressure, specifically a reading of 140/90 or higher, appearing after 20 weeks of gestation without any proteinuria. Now, if that same patient develops proteinuria or signs of organ damage like a severe headache or vision changes, the diagnosis escalates to preeclampsia. The NCLEX will give you a scenario and expect you to identify the correct condition based on these specific signs. If the patient with preeclampsia has a seizure, it becomes eclampsia. The absolute priority nursing action for eclampsia is ensuring patient safety during the convulsion, such as turning the patient on her side and protecting her from injury, not administering magnesium sulfate mid-seizure. A severe complication of preeclampsia is HELLP syndrome. The exam loves this because it's an acronym and requires immediate action. Remember, HELLP stands for hemolysis, elevated liver enzymes, and low platelets. A common exam question will present a patient with right upper quadrant pain, nausea, and malaise, along with lab values showing low platelets and elevated AST and ALT. Your priority is to recognize these signs as HELLP syndrome and prepare for immediate delivery of the fetus, as this is the only cure. Next, let's discuss placental abnormalities. The key is distinguishing between placenta previa and placental abruption based on the bleeding. Placenta previa involves painless, bright red vaginal bleeding because the placenta is improperly implanted over the cervix. Conversely, placental abruption is the premature separation of the placenta from the uterine wall, causing painful dark red bleeding and a hard board-like abdomen. The exam will test this distinction directly, so memorize that difference. Previa is painless, abruption is painful. Moving on to gestational diabetes, the NCLEX focuses on management and fetal well-being. The priority is controlling blood glucose levels, primarily through diet and exercise. However, if medication is needed, insulin is the standard of care. A common exam trap is to offer an oral hypoglycemic agent like metformin as an option. While sometimes used, insulin is the most frequently tested and safest answer for the NCLEX. Finally, for preterm labor, your focus should be on two main interventions. First is administering tocolytics, like terbutaline or magnesium sulfate, to stop or slow contractions. Be prepared for questions about the side effects, such as tachycardia with terbutaline. The second key intervention is giving corticosteroids, specifically betamethasone, to accelerate fetal lung maturity. The exam will test your understanding that betamethasone doesn't stop labor, but instead prepares the fetus for a potential early birth.